I am the Wellbeing team leader at WDH. So the Mental Health Navigators have got myself as sort of day-to-day senior staff to report to, but they also have clinical lead from Swift as well, making sure that I am supporting the navigators through sort of the housing system, because it's not necessarily their first point of call. So yes, they work quite heavily NHS based and the access system one for all the medical notes, but the housing side of things and the platform that we use, I'm very up to date on that. So I'm a good direction to help, let's unpick things a little bit further. So I'd say for me, that's one of the most important things, is that I'm offering to them that I'm readily available to support all aspects of that intervention. Because whilst, yes, they might be providing mental health support, it could have a number of factors that are contributing to that decline in the mental health, and housing can often be that, or certain situations, environmental factors. For them, knowing that I am there, I am available to have conversations. And whilst I'm not clinical, I am sort of senior to help, push something forwards or raise a concern, if it's gone a little bit too far out of their comfort zone, and not necessarily mental health, but other aspects. As a senior, I am always there to pick that up, or if I need to lead out on it, I'll make sure that I'm leading that. The partnership is paramount to this whole project, really, since the get-go, and not just myself, but seniors above me. So it's having really good networks within the NHS, really good sort of day-to-day communication. So myself, I communicate with the Mental Health Navigators direct line manager, clinical line manager through Swift. So we have a really good working relationship. So, I can pick up the phone, email. We have quite regular meetings together. And I think that ultimately was what helps the whole project continue to move forwards, really. So many benefits to the tenant. Personally, just having that in-house is such a good aspect for WDH. So positive that our tenants can be referred internally by our estates team, Cashwise team, employment advisors. So they're not going through sort of a rigorous assessment process. It could be, a quick conversation they've had in passing with somebody that works in WDH, that then knows that they can actually highlight them to our service, with the consent. Having that quick access to lots of different services, but especially sort of mental health and wellbeing. They're not having to reach out to the GP. They're not having to, make that phone call. They can just do a quick online referral directly to us. Obviously we explain to them that but it's not an enforcement side of the business. It's a choice if they want to sort of reach out and come to us. Coming from us, it maybe just seem a little bit more informal and not necessarily, they're making the big leap to access mental health, and familiarity with people. They know that we know about their address, where they live, who they live with, how long they've been with us, what things are going on maybe in the community, other conflicts with neighbours. We have that wider understanding sometimes that perhaps we know will impact their mental health. I think outside of that, other external services might not necessarily pay close enough attention to those sort of environmental factors. We're very fortunate. We've got 4 mental health navigators working within the team. And with that, we also still do have a waiting list for mental health navigators specifically. But I think that just shows the need for it. Referrals are coming in. So hopefully, it's only going to grow, really. I think it's really important that everybody is addressing mental health, and that the impact of people's mental health on their housing situation is huge.